Non-alcoholic fatty liver disease means this accumulation of fat in the liver is not due to alcohol, which is a very common cause, but due to other causes. So what is the significance? This fatty liver disease can present as a spectrum of disorders, from mild asymptomatic form to severest form like advanced liver disease, cirrhosis, and it can even cause liver cancer. The main conditions that will cause this fatty liver disease are: one is overweight or obesity, then presence of hypercholesterolemia, that is high cholesterol levels in the blood, then presence of diabetes mellitus. These constitute metabolic syndrome. How this fatty liver disease will prevent? In most cases, this fatty liver disease will not cause any symptoms. Usually it will be found in a routine checkup for blood when we detect some minor abnormalities in the liver function test, or if you do ultrasound scan for some other reasons for abdomen, then we can find out bright liver. Then we will think about fatty liver disease. And if it presents, sometimes it can present as some minor heaviness in the right upper part of the abdomen, or if it present as advanced liver disease, it can present with the features of cirrhosis or liver cancer, like weight loss, swelling of both legs, protrusion of abdomen, or even can present with other complications like jaundice, vomiting of blood. Okay. So detection of the fatty liver disease at the earliest stage is very important to prevent its progression. So what are the methods by which we can detect the fatty liver disease? One, I already taught, simple blood test. Then imaging of the liver. A simple ultrasound scan image can detect the fatty liver. Now there are new modalities like fibroscans that can detect how much damage the fatty liver has caused to the liver, and what is the risk of progression of this fatty liver to end stage liver disease or cirrhosis in these individuals. Then there are certain factors which will aggravate the progression of the liver disease from simple fatty liver to advanced liver disease, like family history of cirrhosis is present in a patient with fatty liver, then we should be really careful. Then if the patient is having diabetes is a factor which will aggravate the progression of the fatty liver disease to cirrhosis and even hepatic carcinoma. Then the regular intake of alcohol, then the presence of other hepatitis like viral hepatitis B, C, that will also aggravate the progression of the simple fatty liver to complicated stage. So what is the management of the fatty liver disease? The main role is played by the diet modification, exercise and weight reduction. In the diet, we should definitely restrict the calories, and then fatty food items, oily food items, junk foods, and increase more intake of fruits, vegetables, okay, and healthy food items. So the next thing is this exercise. At least 20 to 30 minutes of walking per day in open air is enough. But we should take one precaution. Always this type fatty liver disease people have other chance of other diseases like cardiac disease, then lungs disease, because they have other multiple comorbidities. So you should rule out all these factors to go for regular exercise. And studies have shown that at least 10% weight reduction from the basic weight, if the person is already overweight, significantly changes the damage caused by fat accumulation in the liver. Certainly drugs we prescribe in the management of fatty liver, but the drugs have a very few role and very few proven drugs. Okay, so they are down in the list of this management protocol. So the key message that has to be taken is you should screen for fatty liver, okay, and with simple tests that are available locally, and if it is detected, you should undergo a risk assessment from a qualified physician, and you should have a regular follow-up. And if you are in the high risk, definitely you should visit more frequently. What is the importance of acting in the earlier stage? Once we act in the first stage of the fatty liver and it prevents the progression, definitely it will prevent the cirrhosis. If a condition of cirrhosis is reached, then the natural course is either it can go for a liver cancer or it will result in advanced liver disease that may require liver transplantation.